Hi, today we're going to talk about two different treatments for CRPS, hyperbaric oxygen therapy and Nedrionide infusions. HBOT is the abbreviation for hyperbaric oxygen treatment. These two treatments are not ones that I have done at all. They are not necessarily done together. It's just that there's less information on them. So rather than do two separate shows, I'm doing one. Preface, I've never had either of these treatments. I will present the scientific evidence on HBOT, and I will be presenting an Italian study on Nedrionide. HBOT. Uses of HBOT other than CRPS are usually for scuba divers who come up too fast and get the bends. If you have carbon monoxide poisoning, and also used to speed up wound healing. How does it work? The hyperbaric chamber is a medical treatment in which increases in the barometric pressure over the ambient or outside pressure is employed, increasing the pressure of all gases in the compressed air. It forces higher amounts of oxygen into the body. In a double-blind, randomized, placebo-controlled study, so double-blind means neither the practitioner or the patient know what they're getting. Randomized means that the ones who got the actual therapy were done at random. And placebo control means that the other group that did not have the HBOT treatment got a placebo. So they were studied to aim to assess the effectiveness of hyperbaric oxygen therapy for treating patients with complex regional pain syndrome. Of the 71 patients, 35 were allocated to the hyperbaric group, and 34 were in the control group. Both groups received 15 therapy sessions in a hyperbaric chamber. Pain, edema, and range of motion of the wrist were evaluated before and after the treatment. After the 15th treatment session, and on day 45. In the HBOT group, there was significant decrease in pain and edema, which is swelling, and a significant increase in the range of motion of the wrist. When we compare the two groups, the HBOT group had significantly better results, with the exception of wrist extension. In conclusion, HBOT is an effective and well-tolerated method for decreasing pain and edema and increasing range of motion in people with CRPS, in this case, CRPS of the wrist. I was not able to find anyone who has had this treatment for CRPS who was willing to share their experience. HBOT for CRPS is not covered by insurance, but finding a hyperbaric chamber is not difficult. Finding someone skilled in HBOT for CRPS may be more difficult. And this is what the chamber looks like. Okay. Nedrionide infusions. Again, this is a treatment I've never had. It is a classification of a biophosphate. Biophosphates are traditionally used to treat osteoporosis. Like many drugs used to treat CRPS, It is used off-label for CRPS. There's a study that took place in Italy. The aim of this multi-center randomized double-blind placebo-controlled trial, so we'll go back over that, multi-center, more than one center, randomized meaning whether you got the medication or a placebo was done at random. Double-blind means neither the provider or the patient knows what they're getting. And it was done to test the efficacy of the amino biophosphate Nedrionide in patients with CRPS type 1. If you remember back to what is CRPS, CRPS that is not caused by a direct injury to a nerve is type 1. So how it was done. 82 patients with CRPS 1 in either the hand or foot were randomly assigned to IV infusions of 100 milligrams Nedrionide given 4 times over 10 days or a placebo. After 50 days, the former placebo patients were then given the same treatment. These patients were followed for 20 weeks. Results of the study were within the first 20 days, visual analog scale, VAS score, which is similar to our pain scale, decreased significantly more in the Nedrionide group. Visual analog scale is a method to rate pain that was first used in 1921. In the following 20 days, the VAS remained unchanged in the placebo group and further decreased in the group that was given the actual medication. For the placebo group, no significant improvements were observed. After 50 days, the placebo group was given the medication. In the active group, which means the ones getting Nedrionide, improvements were still evident even after a year. None of the patients who actually received the medication were experiencing symptoms linked to CRPS type 1. Conclusion: patients with acute CRPS 1 were given 4 IV infusions of Nedrionide at 100 milligrams each. These subjects reported relevant and persistent benefits. Risks: as all medications or treatments, there are risks. These risks were explained to the subject. The drug is not without its side effects. Commonly, side effects include flu-like symptoms such as fever, chills, muscle aches, which usually resolve within a few days. Gastrointestinal issues like nausea and vomiting and abdominal pain are also observed. The classification of biophosphates, when used over an extended period of time, run the risk of spontaneous fractures of the thigh bone.